G'day everyone, I'm Tian and I want to start by welcoming you all. When we think of working in the gym, we usually think of working with able-bodied people. But as a personal trainer, we won't always be working with able-bodied people. We will sometimes have to work with people who have a disability. For today's presentation, we will be looking at working with people who are blind. We will look at what the disability is, what the possible causes of it is, communication skills, challenges, and how we need to adapt some exercises when working with people who are blind. So what is blindness? Blindness, by definition, is complete is a complete or partial loss of vision. So in simple terms, a person who is blind is someone who is unable to see. Now you might be asking, how does a person become blind? Well, if we take a look at the first article as shown on the screen, the possible causes of blindness could be retinopathy of prematurity, congenital glaucoma, congenital cataracts, retinochoroiditis scar, retinal detachment, congenital rubella, and optical nerve atrophy. If we take a look at the second article as shown on the screen, the causes of blindness can be uncorrected refractive errors, cataracts, glaucoma, age-related macular degeneration, myopic macular degeneration, and diabetic retinopathy. Now these are all big words that to most of us means nothing. So to put it in simple terms, the causes of blindness could be that you are born with it, or it could be due to an error occurring during the growth of the eye. It could be something as a sickness such as diabetes. It could be due to aging, or it could be due to something as simple as an accident that causes injury to your eye or the brain or the nerve that runs from the eye to the brain. People who are blind have a couple of challenges that they need to deal with. These challenges include being stigmatized and discriminated against, lack of confidence, social exclusion, and getting poor services. The discrimination that they face is that of being treated with less respect or courtesy. This in turn leads to them being excluded and gaining poor services. The challenges that they face is due to a lack of knowledge in our society. So it is our responsibility as personal trainers to make sure that they face as little challenges as possible in the gym by treating them with respect and by providing them with quality services. When meeting a client who is blind, make sure to take them for an introduction through the gym. This way they can create a mental map of the gym to know where everything is located. This will make them feel respected, included, and will improve their self-confidence. The next challenge is communication. When working with a person who's blind, do not grab their arm to help them. Wait for them to ask you for help first. When entering the training environment, familiarize them before you start training. After that, do not move anything around. When you need to leave the room to go get something, or when you come back and enter the room, make sure that you let the client know. Make sure that you let the client know because they cannot see you leaving or entering. When speaking with a person who is blind, make sure to face them directly to make sure that they can hear you properly. Use their name to draw their attention so that they know that you are speaking to them. Do not raise your voice. Speak normally. This is because a person who is blind is not necessarily deaf, so they can hear you fine as long as there is no obstacles between you and them blocking the sound. Also, be very careful of your tone of voice, as people who are blind rely heavily on what they hear to determine your attitude towards them, as well as to know what the message is behind the words. Therefore, always be clear and always give clear and accurate information. Avoid over communicating or giving too much information at once. Focus on key information and make sure that they understand what you are telling them. Be careful of your word choice. Refer to the person first and not the disability. For example, rather say person who is blind instead of saying the blind person. And lastly, make sure to limit the noise around you and them to make sure that they can hear you properly. When it comes to the modification of exercises to fit the client's ability, you will not have to change any exercise, as blindness does not affect the client's physical ability to do the exercises. The only difference is you will have to first familiarize your client with the environment before you start training. After familiarizing the client with the environment, you must not change or move anything around. You will also not show your client how to do the exercises as you would normally do with any able-bodied client. Seeing as the client cannot see, you will have to verbally explain to the client what they must do and how they should exactly perform the exercise. After this, if the form is incorrect, you will have to verbally correct their form, and then if they still don't use the correct form or the correct technique, you will have to physically correct their form. When doing this, if you have to touch the stomach or anterior thigh, you will have to use your forearm and not your hands to touch their body. When you have to use your hands at any other part of the body to rectify the form, make sure that your client is comfortable with this action. Lastly, you have to guide your client by the hand to show them where exactly they should grab the equipment to perform the exercise. In conclusion, blindness is the inability to see and could be caused due to errors during growth, sickness, aging, accidents, or you could be born blind. When communicating with a person who is blind, make sure to face them when speaking, use their name to get their attention, speak clearly and give accurate information, make sure that your client understands you, pay attention to your word choice and your tone of voice, and make sure that you treat them with respect. When doing exercises with clients who are blind, make sure to familiarize them with their environment and do not move anything around after that point. You have to verbally explain to them exactly what they should do or how they should perform the exercise. Sorry about that. And be careful when you have to touch your client to correct their form. Lastly, remember they are human just like you and me, so treat them as such. Thank you for your time and have a great day.